Hi everyone, this is Justin here from Chiropractic Solutions, and I wanted to talk to you about another common injury that we're seeing a lot of in the clinic here, and that's rolled ankles, sprained ankles, plantar fasciitis, or just generalized pain in the foot. Now, what's important to understand is before we go and assess the ankle joint, or the foot for that matter, it's important to understand what controls the foot, and that tends to be the nerves from the lower back. So it's very common for us to be working on the lower back to help someone with the foot, which will take some, if not a lot of the pain away. So it's very important to start with the lower back is what I'm trying to get across, okay? Secondly, now we need to address the foot or the ankle joint. So what's important to understand is the foot and the ankle are mechanical in nature, and they need to be able to track so that you can place your foot down and then roll off and take another step. So sometimes what can happen is if you have an injury, if you roll your ankle or an inversion type of sprain, what happens is your body comes down on top of that ankle. And so that can then upset the mechanics in the foot, which can typically cause a few things to happen. Typically when you have this inversion type of sprain, what will happen is this talus bone can shift forwards, as well as this fibula bone at the distal end, or the bone down here, or that ankle part on the outside of the ankle, that can shift backwards. So that will cause irregular movement in the ankle and therefore will overload the soft tissue structures in the foot. So commonly people who have mechanical dysfunction in the foot will complain of things like pain on the underside of the foot, plantar fasciitis type symptoms. Or they could complain of pain in the ankle joint. They may complain of pain coming up the leg. It could be just generalized foot pain, okay? So what's important to understand is we need to do a thorough examination of not just the foot and the ankle, but we need to address things in the lower back first, because most likely if you've had an injury to your ankle and you've rolled your ankle before, there may be some neurological component that may be causing you to continually roll your ankle because the joints either are not receiving information well from the lower back or the nerves, or it could just be that it's not tracking well in the ankle joint. So there's just a little brief understanding of what it is that we do as chiropractors to examine the ankle. And if you know anyone that has ankle pain, or if you're experiencing recurring ankle pain, please let us know, because it's really not something that's too hard to fix. Cheers.